Skin tags, also known as acrochordons, are small, benign growths that often appear on areas where the skin folds, such as the neck, armpits, groin, and eyelids. They are typically harmless and painless, composed of loose collagen fibers and blood vessels surrounded by skin. While they are not dangerous, many people choose to remove them for cosmetic reasons or because they can become irritated by clothing, jewelry, or shaving. The appearance of skin tags can vary from person to person, ranging from a few millimeters to a centimeter in size, and they may be smooth or wrinkled, flesh-colored or slightly darker. Although the exact cause of skin tags is not fully understood, they are more common in individuals who are overweight, have diabetes, or have a family history of skin tags. Hormonal changes, particularly during pregnancy, and friction from skin rubbing against skin are also contributing factors. While skin tags do not require treatment, those who find them bothersome or unsightly may seek removal. Various methods exist for removing skin tags, each with its own benefits and considerations. Understanding the options and consulting with a healthcare provider can help determine the safest and most effective method for individual needs. Here are some effective ways to remove skin tags. Salicylic acid. Products containing salicylic acid work by exfoliating the skin tag gradually. Consistent application over several days or weeks can cause the tag to shrink and eventually fall off. Tea tree oil. It is known for its antiviral and antifungal properties. Tea tree oil can be applied directly to the skin tag. It's typically used with a cotton ball, which is then secured with a bandage and left on the skin tag for a few hours daily until it falls off. Other ingredients. Various creams and solutions available in pharmacies claim to remove skin tags. These usually contain a mix of acids or herbal extracts that help dissolve the tag. Cryotherapy. This method involves applying liquid nitrogen to the skin tag, freezing the cells, and causing the tag to fall off. It can be done in a dermatologist's office or at home with an over-the-counter kit. It usually requires 1 to 3 applications spaced out over a few weeks. Dental floss or string. By tying a piece of dental floss or string tightly around the base of the skin tag, the blood supply to the tag is cut off. This method causes the skin tag to wither and fall off within a few days to a week. Tag removal devices. Special devices are available that function similarly to the string method, but are designed for ease of use and effectiveness. Excision. A healthcare professional can remove skin tags using sterile scissors or a scalpel. This method is quick and usually done in a clinical setting. Local anesthesia may be used to minimize discomfort. The area is then cleaned and bandaged to prevent infection. Cauterization. This involves burning the skin tag off using an electric current or laser. The heat seals the blood vessels, preventing bleeding. This method is typically performed by a dermatologist. Natural remedies. Apple cider vinegar. Some people apply apple cider vinegar to a cotton ball and secure it to the skin tag with a bandage. The acidic nature of the vinegar is thought to help break down the cells of the skin tag over time. Garlic. Fresh garlic, when applied to a skin tag, is believed to help it fall off. A piece of garlic can be taped over the skin tag overnight for several nights. Banana peel. Rubbing the inside of a banana peel on the skin tag daily is a folk remedy that some people swear by, though scientific evidence is lacking. It's important to consult a healthcare provider before attempting to remove a skin tag, especially if it is large, painful, or located in a sensitive area. Any method involving cutting or puncturing the skin carries a risk of infection. Proper sterilization and aftercare are essential. Ensure the growth is a skin tag and not another type of lesion that may require different treatment. Choosing the right method depends on personal preference, the size and location of the skin tag, and medical advice.